and the government is pushing ahead with national health insurance. They are adamant they want this. But the process has already been hit with a number of legal challenges. President Cyril Ramaphosa signed this into law. That was a couple of months ago, a few weeks ago. But he has refused to provide the record of his decision to sign NHI into law, as requested by the Board of Healthcare Funders. The BHF, representing medical aid schemes, kicked off its case against the NHI on Tuesday in the High Court in Pretoria. The president is arguing that the Constitutional Court and not the High Court should hear the matter. In terms of the Constitution, when receiving legislation from Parliament, the president must satisfy himself that it is constitutional. So he should explain his reasoning. That's the thing. If it gets onto his desk, he should go through it and say, right, does it pass constitutional muster? But this isn't the case. Instead, he's fighting the issue, saying it must just go to the Constitutional Court. We'll sort it out there. Meanwhile, though, the BHF is not alone in fighting NHI in the courts. Solidarity and the Hospital Association of South Africa, which represents private hospitals, are also challenging NHI, along with the SA Private Practitioners Forum. So there are 4 legal challenges, probably 5 coming now. On the line is Dr. Mvuyisi Mzukwa, who's the chairperson of the South African Medical Association, or SAMA. Dr. Mvuyisi Mzukwa, hi, good morning. Good to have you on 702.
Good morning to you, Ray, and to your listeners, and thanks for inviting me.
It's good to have you on. I mean, should the president have signed this piece of legislation a few months ago, or are there obvious problems here? Should he have said, hold on a second, we've got issues here?
You know, Ray, it's really surprising because we, as the healthcare profession, especially SAMA, we've been making submissions, to government, at least the green paper, the white paper, the bill itself. We also made oral presentations in Parliament. Obviously, there was no feedback, even acknowledging receipt of those submissions. So you can imagine, the frustrations. And I think people are doing the right thing. If government cannot explain themselves, without being coerced by the courts of law, I think the courts of law are the right place for, at least, these organizations to get a hearing, from government.
Yeah. Was there consultation here? I mean, I would think the president would have spoken to the SA Medical Association about NHI. Did he do that?
No, it never happened. Even, like I said, even during our submissions, there was no acknowledgement. And in fact, there are so many other issues that we have raised. I mean, you can imagine that this NHI has far-reaching implications for both healthcare professionals and the public. Yet you find that key details are being withheld, which further erode confidence in the process and raising questions about how constitutional the NHI is. You can understand, we've pointed out obvious issues, to government. One was the pillars, the 6 pillars of a healthcare system. You're only attending and you're not talking about the other pillars. And, that raises a question. Even, independent entities like ASAF, the Academy of Science of South Africa, they have raised issues around ethical leadership in healthcare. And they say, if we don't attend to ethical leadership and governance in this country, even NHI will fall on its face.
Yeah. I mean, this is the thing. Earlier on, I was chatting to the DA about the budget, and they couldn't tell us much because, of course, we'll know that on the 12th of March. But none of this makes sense. If you are going to spend R1 billion plus on NHI, you're going to bounce the budget. It's not going to work. It's absolutely not going to work. It just seems there's been no thought process that's gone through this.
This is exactly what we've been pointing out to government to say, the excitement about funding, this funding model of NHI, where you think are going to depend on a taxation, and excluding other contributions, it's not going to work. It's unworkable, and also it's unaffordable. Because we've got a very small tax base and our economy is not growing. So those are the issues that are obvious. Even today, the minister and everybody else in the department has failed to point out how much is needed for the NHI. They are beating around the bush in terms of the amount. But if some people come up with estimates, they are quick to come in and rebut those. But how do you do that without putting on the table what you think is the right amount of the NHI? Because the cost is important. Before building a house, you must have an estimate of how much you're going to spend on that house. And otherwise, it's not gonna pass.
Also, before building a house, make sure you know what's going on inside that house. And I'm talking about the actual structure of NHI. When you and I get sick, Dr. Mvuyisi and Ray, we go off and we get sick and we go to a hospital. What sort of care will we get under NHI? Will we get what we're getting now, or will we get a better picture?
Well, that's exactly the huge challenge, because the benefits have not been defined even today. So you can imagine we're sitting in the dark, regarding a very crucial policy reform, and nobody is willing to come up and say, this is what you should be expecting. And this brings so much uncertainty, especially to healthcare workers and even the public. People don't know what is going to be happening with the NHI. Hence, we are saying to government, if they want to build that confidence, with societies, they should be coming up, transparently so.
Yeah, you're quite right. You're quite right. Something else that's also worrying a lot of people is medical students. And a lot of them are graduating. They do their community service and then they can't get a job in the public sector. They then want to leave and they want to go overseas. And that worries me a lot because we are losing our experts to other countries. When it comes down to NHI, are these same medical students anyway going to have a look at NHI and say, you know what, I'm out of here?
Ray, this is a greatest concern of the South African Medical Association. And it's really, we're facing a huge challenge in the South African healthcare. We have a critical shortage of healthcare personnel in our public hospitals, yet thousands of qualified healthcare workers remain unemployed. And, this disconnect requires immediate policy intervention. More than 1,800 junior doctors who have completed their mandatory community service, they remain unemployed. And you know that according to the World Health Organization, we should be having 1 doctor per 1,000 people. But in our country, it's 0.3 doctors per 1,000 people. So it's a critical and a dangerous shortage in our healthcare system.
Yeah. I want to change tack a little bit. So obviously people need a healthcare system that works. People also can't afford exorbitant medical aid rates. A lot of people can't afford medical aid whatsoever. What's the compromise here? NHI, national health, quality national health for everyone is a good idea. I think you can agree on that. What's the compromise? How do we find middle ground and how do we find a workable solution?
Well, as the South African Medical Association, together with other organizations, we've formed what we call a Universal Health Access Coalition. And we have put a proposal on the table. And that proposal speaks to the issues that we are raising now. First of all, we need to strengthen the healthcare system. How? We need to decentralize. NHI is centralizing. We need to make sure that provinces continue to deliver on healthcare services. But what we need to do in the public sector is, one, we need to make sure that hospitals are independent and they are run or supervised by what you call supervisory boards and not the advisory boards that we have now, so that they can hold those CEOs accountable. But it also gives them a platform, to be innovative. They can even, when they are innovative, they can change the look of the hospitals, but also they can attract even the private patients to come to their institutions. So the leadership is important, but supervisory boards must be there. And coming to the private sector needs a change in terms of how it is structured and regulated. What they've done now, they've come up call HMI recommendations. But we know that, this is a very simplified, in fact, it does not take into account the HMI recommendations. It only talks about the tariffs negotiations. HMI was about a holistic approach. You can't be just attending to the tariffs, which talks to providers. And forget about the hospitals as well. Hospitals are there, are driving the cost as well. You can't be excluding them from this. So that's our input on this. We've got a proposal.
Yeah, that's good to hear. It really is good to hear, because that also perhaps will counter rampant corruption. If you have a look at what happened during COVID-19, if you have a look at what's happened at the Tembisa Hospital and others, it's a major problem, corruption. You need to have a better oversight of this. You eliminate that corruption, you get service delivery.
Here we're talking about billions. I'm glad you raised that thing. Between 2009 and 2013, we lost 24 billion rands to corruption. And like you said, during the period around 2020, April 2020 to June 2021, we were still investigating 14.8 billion that was lost again to corruption. And you can imagine now we've just lost about 17% of the money that is meant to manage HIV and TB. The USAID funding. So you can imagine the impact, but much more is being lost due to corruption. Like you said, Tembisa alone is about 3.4 billion that was lost in Tembisa.
Sure.
Just one hospital.
That is a lot. That is a lot of money. Dr. Mvuyisi Mzukwa, thank you so much for coming on to 702, chairperson of the South African Medical Association. Do appreciate you taking the time this morning. And it just goes to show the problems that we have in our general health sector. It's not only about NHI. NHI is a good idea. I think it is a good idea, the concept of it, but the implementation of it is very, very poor. And I do think, Mr. President, you need to let us know why you signed this legislation into law and let us know the reasoning behind it. We do need to understand.
Current events, developing stories,
tough questions,
your voice making a difference.
This is Breakfast with Bongani Bingwa.